Hello everyone, this is Dr. Divya here. This is a short video just for the final year students and those preparing for the PG entrance exam on APGAR score. This is a frequently asked question. So I decided to make a short video because it is a volatile thing. Until you put it to practice, you keep on forgetting this. So this is the score here. This is the APGAR score. What I am depicting here is an expanded APGAR reporting scores that we encounter in the delivery rooms while we are receiving the babies. So APGAR, it could be remembered as a simple mnemonic, that is APGAR. A is for appearance or color, right? We give 2 if the baby is completely pink. We give 1 if there is acrocyanosis, that is the extremities of the baby are blue while the trunk of the baby is pink. So that's 1. If the baby is completely blue or pale, that's 0. Okay. The second component is P. APGAR P. P is for pulse rate or heart rate in babies. If the heart rate is more than 100, then it's 2, less than 100, 1, and if it's absent, 0. Then comes grimace. G for grimace, or that is reflex irritability. If the child is crying or there is active withdrawal to the stimulus, then we give 2 score. If the child gives a grimace response, then it's 1. If there's no response, then 0. Then comes A again, APGAR. A here is activity. If the child is actively moving, we give a score of 2. If the child shows some degree of flexion, then we give the score as 1. If the child is limp, there is no tone, no movement, then we give the score as 0. And finally R is for the respiration pattern. If the respiratory efforts are good and the baby is crying, we give the score as 2. If the child is weakly crying, the respiration pattern is not that good, then we give the score of 1. And if there is no efforts, respiration is absent, then we give the score as 0. Okay, so the maximum score here would be 2 into 5 for the parameters, that is 10, and minimum score would be 0 obviously, right? So we monitor this APGAR at 5 minutes interval. The first is done at 1 minute, then 2 minutes, subsequently at 10, 15 and 20 minutes. Simultaneously, all the resuscitative efforts that we are doing are also recorded in the sheet. 1 minute if we gave any oxygen or positive pressure ventilation to the child, because in the NRP protocol there is given that if you have to start positive pressure ventilation, that should be done within 60 seconds or 1 minute. That is also known as the golden 1 minute, right? So if the APGAR score requires positive pressure ventilation, we will mention here. That's all about APGAR score. Before the exam, be it your final practical viva exam or INICET or NEET Pg, these are the frequently encountered questions, and you should never ever forget to brush them out before the exam. That's for today. Have a nice day.